Hello ladies and gentlemen, welcome to Remedy 24. Today we're gonna show you about vitamin C side effects and 5 things you should know. Vitamin C is a water-soluble vitamin that can be found in many fruits and vegetables. Getting enough of this vitamin is critical for maintaining a healthy immune system. Wound healing, bone strength, and cognitive function are all aided by it. Surprisingly, some people believe that vitamin C pills provide benefits in addition to those obtained from the diet. One of the most common reasons people take vitamin C supplements is because they believe it will help them prevent getting a cold. Many supplements, on the other hand, provide extremely high amounts of vitamins, which in certain cases may have adverse side effects. This video clip examines vitamin C's overall safety, as well as whether it's possible to take too much of it and the hazards of doing so. Number 1. Vitamin C is a water-soluble vitamin that the body does not store. Vitamin C is a water-soluble vitamin, meaning it dissolves when it comes into contact with water. Unlike fat-soluble vitamins, water-soluble vitamins do not accumulate in the body. Instead, body fluids transfer the vitamin C you eat to your tissues, and any excess is excreted in the urine. Because your body does neither retain nor generate vitamin C on its own, it is essential to take vitamin C-rich foods on a regular basis. Supplementing with large doses of vitamin C, on the other hand, might have negative side effects such as digestive discomfort and kidney stones. This is because if you flood your body with higher than normal amounts of this vitamin, it may start to build up, potentially causing overdose symptoms. It's important to note that most people don't need to take vitamin C supplements because they may get plenty from fresh foods, particularly fruits and vegetables. Number 2. Too much vitamin C might cause gastric problems. The most prevalent side effect of excessive vitamin C consumption is intestinal pain. In general, these side effects are induced by taking vitamin C pills instead of eating vitamin C-rich foods. You're more prone to get stomach trouble if you consume more than 2,000 milligrams at once. As a result, a daily maximum of 2,000 milligrams has been established as an acceptable upper limit. The most common digestive side effects of increased vitamin C use are diarrhea and nausea. Excessive intake has also been connected to acid reflux. However, there is no evidence to back this up. If you're having digestive problems as a result of too much vitamin C, simply cut your supplement dose or skip vitamin C pills altogether. Number 3. Iron excess may be caused by vitamin C. Iron absorption is known to be aided by vitamin C. It has the ability to bind to non-heme iron contained in plant meals. Non-heme iron is not as well absorbed by the body as heme iron, which is found in animal products. Vitamin C binds to non-heme iron, making it easier to absorb for your body. This is a critical function, particularly for people who acquire the majority of their iron from plant-based meals. When adults took 100 milligrams of vitamin C with a meal, their iron absorption increased by 67%, according to one study. Vitamin C supplements should be avoided by people with disorders that raise the risk of iron accumulation in the body, such as hemochromatosis. Taking too much vitamin C in these conditions might create iron overload, which can harm your heart, liver, pancreas, thyroid, and central nervous system. However, if you don't have a disease that enhances iron absorption, iron excess is uncommon. Additionally, when too much iron is taken in the form of a supplement, it is more likely to cause an iron overload. Number 4. High-dose supplementation can cause kidney stones. Excess vitamin C is eliminated as oxalate, a waste product in the body. Oxalate is usually excreted in the urine. Oxalate, on the other hand, can bind to minerals and form crystals, which can contribute to the production of kidney stones in some cases. Too much vitamin C in your diet might raise the quantity of oxalate in your urine, raising your risk of kidney stones. The amount of oxalate excreted increased by 20% in one research in which adults took a 1,000 mg vitamin C supplement twice daily for 6 days. High vitamin C intake is connected to increased urinary oxalate levels as well as the development of kidney stones, especially if you ingest more than 2,000 milligrams per day. People who use more over 2,000 milligrams per day have been documented to get renal failure. This is, however, relatively uncommon, especially in healthy persons. Number 5. When it comes to vitamin C, how much is too much? It's difficult to overdose on vitamin C because it's water-soluble and your body excretes excess levels after a few hours of consumption. In fact, getting too much vitamin C from your diet alone is practically impossible. Any extra vitamin C ingested in excess of the required daily quantity is simply flushed out of the body in healthy persons. To put it in perspective, you'd have to eat 29 oranges or 13 bell peppers before reaching the upper limit of tolerable intake. When people take supplements, however, the dangers of vitamin C overdose are higher, and it is possible to consume too much of the vitamin in rare cases. Those who have illnesses that enhance their risk of iron overload, or who are prone to kidney stones, for example, should limit their vitamin C intake. When people consume massive amounts of vitamin C larger than 2,000 milligrams, all of the negative consequences, including digestive distress and renal stones, appear to occur. If you decide to take a vitamin C supplement, make sure it contains no more than 100% of your daily requirements. That's 90 milligrams for men and 75 milligrams for women every day.